Good afternoon. My name is Carmen Arteaga, and today I will be presenting on effective anxiety reduction interventions. As a nursing students, we face a unique level of stress, balancing rigorous coursework, clinical responsibilities, and the pressure of the exams. Many of us have experienced anxiety and so many times, whatever before a major test, during a clinical practice, or while managing multiple responsibilities at once. This topic is important not only because it affects us as a student, but also because as a future nurses, we will care for a patient who experience anxiety in many forms. Understanding how manage anxiety is in ourselves allows us to better support others. Nursing students are very anxious because of the high demands that are imposed on them, such as requires intensive coursework, high expectations, and demanding clinical settings. The transition between theory and practice, when errors make or critical importance. It's a stressful experience for many students. The effects of anxiety include concentration, memory, and academic performance. It is also capable of decreasing confidence in clinical practice. Do these difficulties affecting intervention that will be tackled emotional and academic stressors should be implemented. Early support as students can help to avoid such a long-term outcomes as burnout, low performance, and the dropout of nursing programs. The effects of anxiety are severe in the classroom. It impairs the ability to think critically and make decisions, which are important in nursing practice skills. Anxious students tend to do poorly at school and might have difficulty in the clinical environment. This may result in burnout and even abandoning nursing program as the times go by. Students with anxiety can commit more mistakes in the clinical settings, which can adversely affect patient safety. This issue is tackling anxiety are hence not only in the student well-being, but also in the quality of healthcare delivery. Nursing students can be supported to create a stronger, safer, and more competent healthcare workforce. Nursing students have several major reasons that cause anxiety. The fear of errors is one of the key reasons, particularly in clinical settings. When patient safety is at stake, a student has to experience heavy workloads, strict deadlines, and rigorous academic schedules. The clinical setting may be stressful based on new experience and expectation of the instructor and healthcare providers. A significant number of students do not feel confident as they are still in the process of building their skill and knowledge. Such pressures combined make the learning environment a challenge, which adds to more anxiety. Knowing such a reason, we need teachers to develop specific interventions that can be used to alleviate the stress and enhance students' performance. This intervention had the potential to alleviate anxiety levels in nursing students. Students who practice meditation, deep breathing, and grounding exercise can learn to stay present when managing the stress. The practice provides people with emotional control abilities, which can help them to focus better because these skills are essential for achieving success in academic and clinical settings. People who practice mindfulness experience reduced cortisol levels, which results in a state of relaxation. Those students who practice mindfulness on regular basis report less anxiety and better well-being. All these methods are easy, inexpensive, and can be incorporated into nursing programs. Mindfulness trainings will be introduced as part of those curriculums, which can have a great effect on the mental health of the students as well as their academic outcomes. Cognitive behavior therapy exists as an effective approach for anxiety treatment, which has gained widespread acceptance. The process requires people to recognize their negative thinking patterns, which they must replace it with positive and realistic thoughts. Cognitive behavior therapy can use to overcome the self-doubt and fear and failure that nursing students have. Students can learn to question these thoughts to come with the better coping strategies. Cognitive behavior therapy is a successful form of intervention in reducing anxiety. Implementing cognitive behavior therapy methods as student support programs can significantly improve emotional and academic performance. Peer support is important in alleviating anxiety in nursing students. Students will feel that they are not the only ones, as they will share the experience. This lessens their feeling to loneliness and create a feeling of the community. Peer groups offer emotional support, encouragement, and practical advice. The groups also create an environment that helps nursing students to develop their essential teamwork abilities. When students perceive that their peers support them, they will cope with stress. Peer support can be promoted in nursing programs by group activities. Mentorship programs and student groups such as programs create a favorable learning atmosphere and enhance the well-being of the students. Anxiety among the nursing students can be reduced by the use of simulation-based learning. It provides a safe and controlled environment where students can practice clinical skills without risking patient safety. This will make a student less afraid of mistakes and will enable them to learn through the error. Simulations also assist to the students to gain competency and confidence prior to their involvement in the actual clinical environments. Repeating scenarios help students to feel more easy and ready to face the real situations. This method is a way to closing the gap between theory and practice. Time management serves as an essential tool that helps nursing students decrease their anxiety levels. Students who fail to manage their time properly will experience stress because they cannot meet deadlines, which leads to overwhelming situations. One of the most popular ways to students to keep academic responsibilities organized and clear is by organizing a to-do list with the priorities. This enhances efficiency and time to rest and care for ourselves. Cultivating skills on how to plan eliminates last-minute stress as well as anxiety. The time management skills also enable students to create a balance between academic life and personal life. Nursing courses can assist to students by instructing them on how to manage time and offer them a structured program. Such skills are useful for both in the educational process and the job. One of the most important factors that help decrease the levels of anxiety among nursing students is faculty support. When instructors guide and support the students, they will feel more confident and supported. Open communication aims to the students to communicate about the concerns and get assistance when it's necessary. Positive feedback assists the students in development better without any discouragement. Students are likely to achieve when the faculty provides a good and a conducive atmosphere. Mentorship programs are also significant in steering to the students through the hardship. Students learn best when they feel they are connected with and trusted by their teachers. One of the key aspects of coping with anxiety is self-care. Exercise, relaxation, and sufficient sleep are among the activities that lead to better health physically and mentally. Exercising decreases the stress hormones and make a person feel good. Deep breathing and yoga are relaxation methods that relax the mind. Healthy living helps to resilience in the long run and avoid burnout. Self-care is neglected by nursing students because of hectic schedules. Success is very important when you apply self-care practice can encourage to ensure that students are able to cope with the stress and balance during the school years and beyond. School provides crucial support to nursing students through their educational journey. The present and mental health resources, together with counseling services, help students to manage their anxiety issues. Academic support programs assist students who help them achieve success and build their self assurance. A secure and inclusive learning environment will encourage students to seek help whenever they require assistance. Anxiety should be prevented through early interventions to avoid severity. Schools that invest in support systems for students experience reduced dropout rates and improve academic performance. These programs not only help in development quality and confidence in nursing, but also to healthcare systems, signs they are well prepared. This chart demonstrates how various interventions can be useful in alleviating anxiety among nursing students. Research findings demonstrate that mindfulness activity had the most effective levels. Peer support is also beneficial, but it can have a different effects, which can be positive or negative depending on involvement. The learning through the simulation enhances confidence greatly, which indirectly lowers anxiety. These results suggest the need to implement a combination of interventions instead of applying one of them. The best approach in dealing with anxiety among nursing students is a comprehensive strategy that encompasses psychological, social, and educational support. The best method of reducing anxiety among nursing students is through the combination of intervention. The various strategies target different dimensions of the anxiety, including emotional, cognitive, and environmental dimensions. As an illustration, mindfulness is used to regulate emotions, whatever cognitivity focusing negative thinking, social connection is found in peer support, and confidence is developed through simulation. These methods will combine for assisting of full support. This not only enhances academic and clinical performance, but also resilience in the long term. The nursing programs are advised to integrate to provide well-rounded support to the students during their learning process. In conclusion, anxiety is something many of us experience as a nursing students, especially with the demands of exams, clinicals, and responsibilities. However, by using effective anxiety reduction strategies, we can better manage stress and improve both our academic performance and overall well-being. My goal is these strategies can not only help us now, but also support us in our future roles as nurses, so we can provide better care for our patients. Thank you for listening to my presentation. Have a wonderful night.